You've heard about people talking about omwana n'ekituli ku mutima, or babies have holes in their heart. And sometimes some people you're going to find for and they're going to try to hustle you based on certain information. So I'm going to teach you a few concepts about what does it mean that omwana n'ekituli ku mutima, and is it a bad thing? Let us begin this session. Class is in session. So when someone says they have a baby have holes in their heads, there are some we're going to call good holes or good vituli, and bad holes or bad vituli. Now the good holes are three main holes. There are two holes at the level of the heart, and there is one hole at the level of the baby's liver. The two holes at the level of the heart, one is called the pattern, the foramen ovale, which is between the right atrium and the left atrium, basically the right and the left side of the heart. There's one called the ductus arteriosus, which is on the level of pulmonary artery, or the blood vessel that is taking blood to the lungs, and the one that is taking blood out of the lungs. Then there's one at the level of the liver. And all these holes are meant for one purpose, to divert blood. You know how like on the road when you're driving, someone is constructing this area, they put road diversion? Yes, so it's trying to divert blood from the lungs, because this baby's blood, when they're inside the uterus, they are filled with fluid. So they don't use their lungs to oxygenate like we do. All their oxygen comes from the placenta or from the mama through something we call the umbilical vein. And so because of that, these holes are meant to divert the blood, because if blood begins going to the lungs, which are filled with water, they're not going to be functional. They're not going to help the baby. They are not functional lungs until they come out and they make the first cry. Now, there are also those that we call the bad holes. There are some other holes like we call ISD, or you see something called the VSD, or the ventricular septal defect, or the atrial septal defect. Those other types of holes. These are also holes that we see in the babies, which we don't really want. The good holes, we want to keep them open. That is why they emphasize you do not take drugs that have been prescribed to you during antenatal. Because even drugs as simple as ibuprofen or diclofenac that we normally use for painkillers or as painkillers, they can end up closing these holes before time. If they close the holes before time, they close the holes of the baby inside. And it's like, for lack of a better word, the baby will as if drown or suffocate from inside, especially in third trimester. Just simply do not touch them. That is why do not quetumikiza yourself and give yourself medicine that has been given to you. The only way you can confirm that this is a bad hole is one, your baby is born and they're having breathing difficulties, they are turning, the baby has other features that are showing something is not okay with their oxygenation. And then you end up doing something called an echo, which is a scan that is done to view the heart by a cardiologist only and only and only, who will do the scan and then confirm to you you're having a bad hole. Sometimes you can find you have a bad hole, but the bad hole is small. Sometimes you can find the good hole hasn't yet closed on time. And so because of that, depending, how is the baby? When we say baby, how is the baby? Is the baby going well? Can we just use drugs? But there are some holes which are too big, and because maybe so much difficulty in that, or even other complications of the heart, in that the baby cannot live long unless surgery has been done promptly and well. Then even there are some heart conditions whereby even surgery cannot help. So you just simply have to counsel the parents, counsel the family, and let them know that right now there is so little that we can do to help the baby. I hope you've learned something. Let them not go and confeder you outside there, because you're part of this community that learns and grows and flourishes, and we do so much better for our families. That is it for today. Class dismissed.